Ros Bates, appreciate you coming in. The opposition has spoken repeatedly about ambulance ramping. Emergency doctors tell us that they need an extra 2,500 inpatient hospital beds over the next 4 years to alleviate the pressure. Would an LNP government give them that?
Well, thank you for having me on, Jess. I really appreciate that, and obviously our health system is in crisis and Queenslanders deserve a world-class health system no matter where they live. We need to make sure that we have enough beds for the patients who are arriving at the front door, and the only reason that we actually have ambulance ramping is because of bed block behind it. But you can build as many beds as you like, but you actually have to have the staff to attend to the patients.
Yeah, and the emergency doctors agree with you. They say the staff need to go with it, but they're very specific, 2,500 beds needed over 4 years. Can you deliver that?
Well, certainly. We would consult with the doctors, and as we have done with the AMAQ when they raised the issue about the lack of beds in Queensland in the first place. Each HHS certainly needs to have consultation about what they need in their EDs.
Do you have a number?
Certainly we have matched the Labor government's promise for beds, just like the workforce plan that they have actually outlined.
So you'll match it but not exceed it?
Certainly match it, but if there is more needed, and that's what the HHSs tell us that is needed, then we will listen to the experts.
You've set some concrete targets, including that an LNP government would stabilise wait lists within 12 months. What exactly does stabilise mean?
Well, we need to make sure that it doesn't keep going north like it has been. So it's doubled since the ALP came into government. We know that there are 62,000 people waiting on the wait list. We know that people are not being seen within the recommended timeframes for their surgeries.
So that number would not increase under an LNP government?
Certainly there will always be people who need to have surgery, but we have to make sure that the people who are on the waiting list right now to have their surgery are dealt with. We will work closely with the doctors, with the operating theatres, with the HHSs to make sure that those waiting lists go down.
Schoolies is just around the corner, and Labor has said that they would set up a pill testing service at schoolies this year on the Gold Coast if they're re-elected. Will there be pill testing at schoolies under an LNP government?
We have said no to pill testing because we don't want to encourage the use of illicit drugs. There is no safe way to take a drug. And we have been very clear about that.
The Royal Australian College of GPs supports it. The Alcohol and Drug Foundation supports pill testing. If those organisations support it, why shouldn't you? I
would like to see better education of our young people in the first place about how dangerous illicit drug taking is.
But doesn't the research say that pill testing can reduce harm? It's been introduced in 20 countries around the world, as well as in New Zealand. Victoria's doing it, the ACT's doing it.
The Labor government has allowed people to carry more illicit drugs than ever before. The amount of personal use that can have has increased. I am not going to encourage young people to use drugs. There is no safe way to take drugs.
I've read your speech in Parliament in 2018 to the termination of pregnancy bill, and at that time you said you supported removing abortion from the criminal code, but that you could not support terminations to 22 weeks. Is that still your position?
We have categorically ruled out any change in that legislation, and it's not part of our plan.
Yes, I understand that, but is that still your position, that speech that you gave to the Parliament?
As I said, we have categorically ruled out that we are not going to change that legislation. This is a scare campaign, and a horrible scare campaign from the Labor Party. This is a deeply personal issue for many, many people, and the decriminalisation of abortion bill has passed, and we have no plan to alter that at all.
If that's the case, why are you preferencing Family First in your seat, which is a staunchly pro-life party?
Jess, I'd prefer not to preference anyone. If you remember, within 13 minutes notice, Labor came in and changed the vote 1 to full preferential voting. I don't want to preference anybody, and neither does anybody in my electorate. They would actually like to vote 1 for me.
But there are other candidates, but you've chosen Family First.
Well, I wasn't going to choose the Greens or Labor.
What message does it send, though? You're saying, you're trying to tell people there'll be no changes to abortion, but you're preferencing an anti-abortion party?
I would prefer not to preference anybody, Jess. That's just the way the Labor government have turned it around, so people don't have a choice. They really want to just vote one, and we're stuck with preferences that none of us want.
Labor has billboards up claiming that the LNP will privatise satellite hospitals. Is that true?
Jess, that is an absolute lie. That is a Labor lie. It has never been part of our policy. We have agreed with everything in the forwards for health, for their big build. That is a lie.
Ros Bates, thank you.
Thank you very much, Jess.
Health Minister Shannon Fentiman, thank you very much for your time. I want to pick up where I left off with Ros Bates, who says that Labor billboards stating the LNP will privatise satellite hospitals are a lie. How do you respond to that? Are you being dishonest with voters?
Well, Jess, what we know about the LNP and satellite hospitals is they've never supported them. And we've announced, regional Queensland will now be the beneficiary of our satellite hospitals, but the LNP won't commit to them. I am really pleased to see how well our satellite hospitals have supported families and are taking pressure off our emergency departments.
But at no stage have they said they're going to privatise them, have they?
Well, we also know that the LNP have $17 billion in unfunded election commitments, and David Crisafulli has committed to returning to surplus. So that has to mean cuts somewhere, Jess. And we know they have a track record of privatisation and of cuts to the health system.
But these billboards, they're not expressing a fact, they're expressing what, a suspicion or a fear.
Well, and again, I think Queenslanders need to know that our health staff are really terrified of what will come. They cannot reach surplus with $17 billion in unfunded election commitments without cuts. And we know their track record is cuts.
Well, let's look at your track record. The Australasian College for Emergency Medicine says emergency departments are under unprecedented pressure, waiting rooms are full, ambulances are ramped, and ED staff are experiencing burnout. Why has it gotten to this point under Labor's watch?
Well, we know our emergency departments and our hospitals are under pressure. Every hospital system in the country and the world is under pressure coming out of a global pandemic. But what I am so pleased to see is that on every performance measure, whether it's ambulance ramping, seeing people within the clinically recommended time at our EDs and elective surgery, Queensland is improving.
And yet the college says that Queensland currently does not have enough staff, beds or other resources to meet current and future demands.
And I work closely with the college, and they know that we have committed to so many more frontline staff and, of course, our huge big build, which is delivering beds. I mean, I'm here at the Logan Hospital. You can see the construction behind me. We have hundreds more beds coming online here and at almost every other major hospital, as well as 3 new hospitals.
On ambulance ramping, the LNP set a target of less than 30% in the next 4 years. What is your target?
Well, Queensland has had a target for a long time to get 90% of patients off stretcher within 30 minutes. Now, we've got a lot of work to get back to 90%. I've always said I want to get us back to where we were pre-COVID, and we are on the way.
So when will you achieve that?
Well, as soon as we can, and that's why we're investing in the frontline staff and the beds and all of the initiatives that we've listened to clinicians about what improves patient flow. So as soon as we can, get it back to where we were pre-COVID, and eventually that 90% target, that's what we're working on. We're throwing everything at it. That's
not a time frame though, that's so open-ended.
Yeah, well, look, it is open-ended because I don't want to put a time frame on it. I want it to happen as soon as we can.
Minister, the Legalised Cannabis Party is running in 29 seats this election, and in 28 of those, Labor is preferencing them second. Why is that?
Well, that's a decision you'd have to ask the Labor Party. They make decisions about preferences.
And they don't happen by accident, and that is also what your How to Vote card says in your seat. Why are you preferencing that party?
Well, certainly we have preferenced the Greens and legalised cannabis ahead of Family First, the LNP and One Nation, because the Family First, the LNP and One Nation are all against a woman's right to choose and will take us backwards when it comes to our rights and our bodies on abortion.
Their platform is to legalise cannabis for personal use. Do you think it should be decriminalised altogether, cannabis for personal use?
No, our platform is really clear. What we have done is make sure there is more diversion in the system. So if someone is apprehended because they have a small quantity of illegal substances on them, they are then diverted to a health provider to help them overcome their drug and alcohol addiction, and that is appropriate. They should be receiving health care, but after a number of diversions, they will then eventually go to the criminal justice system and the courts, and I think that's a really good balance here in Queensland.
All the opinion polls have been pointing to a Labor defeat for a long time. If that does happen, are you interested in being opposition leader?
I have to tell you, Jess, between being the health minister and now campaigning in my community here in Logan, I haven't had any time to think about it. Stephen Miles has been doing a fantastic job, and we have to win, because what is at risk is not just cuts to the health system, but abortion being wound back. Like, I am terrified that if the LNP win, you know, women's bodies and their choices will be taken away, and that is terrifying, and that's why we have to win, and that's what I'm focused on.
Shannon Fentiman, thank you.
Thanks, Jess.